Posted at my website at Smerconish.com. Also in today's newsletter, in all of my social media right now, is a great essay co-authored by my next guest. It's under the headline, Don't Want a Vaccine? Be prepared to pay more for insurance. Dr. Elisabeth Rosenthal is the editor-in-chief of Kaiser Health News, also the author of An American Sickness, How Healthcare Became Big Business and How You Can Take It Back. Dr. Rosenthal, thanks so much for being here.
Thanks for having me.
I remember years ago when I was getting a life insurance policy being written by a good friend of mine, Bob Flood. We're still friends. And when I asked him why he was recommending one policy for me as compared to another policy, he said to me, well, you're somewhat of a problem. You're a smoker. I'm a cigar smoker, an occasional cigar smoker, not a cigarette smoker. And he was explaining to me, this was actually pre-ACA, but he was explaining to me that the market is less in terms of underwriters for someone like me, and I would have to pay more. And guess what? I understood why that would be the case. There's a similar argument, is there not, to be made for the unvaccinated among us?
Well, I think there's actually a stronger argument. We do in health insurance, generally we cover smoking-related disease costs, we cover alcohol-related illnesses, but those illnesses affect the person who smokes or drinks, and those are diseases. Not getting a vaccine is not a disease. It's a choice that is free, right? It's free to get these vaccines. And if you choose not to get a vaccine because you don't worry about your health and you don't worry about the health of your grandparents or your coworkers, I think there's a good argument to be made. You should pay more for your health insurance because not only are your bills going to be great, but because your bills are going to be great, it's going to make my bills higher because that's how health insurance premiums work. And that's exactly what your underwriter was telling you.
So how was this issue handled before the vaccine was available, and how, if at all, has that then changed?
Yeah, and people should know about this because before the vaccine was available, health insurers, a little bit to my surprise, did the right thing. They said, we are going to waive patient deductibles, co-payments, co-insurance if they get sick with COVID. Because COVID hospitalizations, like at Kaiser Health News, we get the bills. These are hundreds of thousands of dollars typically. So a deductible might be $7,000, co-payments in the several thousand more. So they waived all of those because you couldn't help getting COVID in those days. But now there's a free vaccine that the government paid for, that all you have to do is, in many places, go to a bus stop or a CVS and get. And so now you're going to bear the burden of those costs. All of those waivers have disappeared. There may be a few still lingering, but by and large, if you get sick with COVID, you are going to be out thousands, if not tens of thousands of dollars, even if you have insurance. So if all of those other incentives to get vaccinated didn't move you, maybe your wallet will.
So the copay, the deductible, the out-of-network treatment that you might require, where prior to the availability of the vaccine, that was being waived. Now, you're unvaccinated, you're going to be on the hook for that.
You're going to be on the hook, and you should, frankly, in my opinion, because there is a way to prevent all of this. The COVID vaccines, they do not prevent you from getting COVID, but they do very, very effectively prevent you from getting hospitalized or really sick or dying of COVID. And that's where the big money comes in. And we get these terrible letters all the time now, emails from doctors who work in ICUs, and the data bears this out. Every one of the patients in my ICU right now didn't get vaccinated. And that's tragic, at this point in time where the vaccines are so widely available, where many states have said, we will bring you one in your home if you will get it. Why should we all pay for that kind of unwillingness to do the right thing?
You cited a statistic in your essay that you co-authored that I've read elsewhere. 97%, this is last month's data, 97% of those hospitalized across the country for something COVID related have something else in common. They are unvaccinated.
Right. They are unvaccinated. This is, as Dr. Fauci says, we are now a country, we are now two countries, one of the vaccinated and one of the unvaccinated. And the unvaccinated are still getting sick. They're still dying. They're still overwhelming hospital systems. Poor doctors and nurses have to treat people and watch them die because someone chose not to get a vaccine. And, now we're hearing some regrets from people saying, oh yeah, I wish we'd gotten vaccinated, but even that doesn't seem to move people. It's to me kind of baffling. If there was something you knew could protect your loved ones from a deadly disease, why wouldn't you do it? But it isn't moving the needle enough. And the problem to me is that affects us all. If there are low vaccination rates in Missouri and Arkansas, even though I live in a state where there are very high vaccination rates, though people from those states are going to be bringing COVID and the Delta variant to my front door. And, the problem is even people who are vaccinated, if you've got an underlying illness, if you've got an immunological deficiency, you can get sick. That's those 3% that, have gotten vaccinated, but are still getting sick. So it's just not fair to society. It's not like smoking in the sense of you're affecting everyone by not getting vaccinated, not just you and those immediately around you.
So, Dr. Rosenthal, what else can be done? I loved the way you framed this. You asked this question: why should patients be kept financially unharmed from what is now a preventable hospitalization thanks to a vaccine that the government paid for and made available for free? You've already said that the insurance companies initially did the right thing. They waived the deductible, they waived those co-pays and so forth. But what now can be done if we want to increase the financial pressure on the unvaccinated?
Well, so far we've both the insurers and state and federal governments have tried to use carrots rather than sticks, right? Like maybe you can win a college scholarship or a free beer or, a ticket to a cool concert where those are occurring. But that hasn't worked, right? And so I guess my argument was maybe it's time to try the stick approach. Maybe it's time to say, okay, you will pay higher premiums if you haven't been vaccinated. Or maybe we will expect you to pay your hospital costs or a greater share of them if you haven't been vaccinated. Because it really isn't, some people say, well, we don't make people who are obese pay more for their hospital costs. But, obesity is a disease. It takes a long time to reduce your weight. It's hard. Getting a shot is not hard. It takes 2 seconds. It's free. So I think it's just not a good analogy. I think we need to move from carrots to sticks.
Okay, so how about this? Should we be treating, I'm trying to distill this in a way that I can present it to my callers. Should we be treating the unvaccinated like the obese, or like the scuba diver, or like the rock climber? Someone who's making a deliberate decision to engage in risky behavior. Is that a fair way to frame it?
Yeah, I do think that's a fair way to frame it. And I kind of think it's even more than that. None of these analogies quite work because getting a vaccine is so easy. It's not a really fun hobby or something that gives you great joy, that you want to do like rock climbing or scuba diving, which some health insurance policies do exclude if you have an accident. Some health insurance policies do exclude if you have an accident. This is so easy now that I think you should even have, in a way, more of a penalty. Think of it that way.
Are any insurance companies doing what you're suggesting right now?
Not that I know of. They're still using the carrot approach rather than stick. We'll give you a good rebate on your health club membership next year. But as you know very well, the anti-vaccine crowd in this country is very kind of hardened in their position. So I think you kind of need to make people pay and realize that they will pay, and they will pay upfront maybe if they make this decision. So, we don't say to people, seatbelt laws are seatbelt laws. You don't say you can choose to wear a seatbelt or not. And I think, the next step, of course, will we do a vaccine mandate? One thing that would make that much easier is once these vaccines move from having emergency use authorization, which they have now, to full authorization, which we're expecting in the next month or two, that may make it easier for states and governments to say, you have to get this vaccine, not for yourself if you don't want it for yourself, but for the safety of us all, for our country to get herd immunity, which is really the ultimate goal of this. And that is what will make COVID go away, nothing else.
Well, I wonder if when there is final approval, I wonder if that will then be the green light for the insurance companies to do what you're recommending here.
It could be, because, when it has emergency use authorization, it kind of sounds like maybe there's something we don't know, that it hasn't been studied. At this point, that's not true. It's really a procedural bureaucratic problem that is the only reason it doesn't have it yet. So we know these vaccines are safe and very effective, and they will stay so long as enough Americans get them to prevent the evolution of new variants against which they are not effective. So this is really urgent. It's urgent that we find a way to get people vaccinated now. And, great to offer them lotteries, great to offer them free beers, but now I think we have to move into you got to do this.
Amen to that. Dr. Elisabeth Rosenthal, editor-in-chief of Kaiser Health News. Your best-selling book from 2017 is called An American Sickness. Thank you so much for being here to explain. I really do appreciate it.
Thanks. I hope this moves the needle a little bit.
No pun intended.
Yes. But moves the needle into arms. How's that?
There you go. I like it. Thank you, doctor. Very much appreciate it.